Hello, welcome to Advancing Health Literacy, Improving Self-Management and Empowerment for Health Outreach Workers. This is the third module in a series of trainings brought to you by the New Haven HEAL Initiative. The New Haven HEAL Initiative aims to improve health outcomes for New Haven residents to reduce COVID-related disparities and to increase patient engagement in their healthcare. To refresh your memory, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decision and actions for themselves and others. In our most recent training, we went over how to assess, select, and create easy to understand materials, how to use health education material effectively, and how to welcome residents. During today's training, we'll be going over a few tools you can use to improve self management and empowerment in the community. Tool number 14 is encouraging questions. Residents are sometimes embarrassed to ask questions, and, in some cultures, deference to authority stifles questions. Creating a shame free environment that encourages residents to ask questions is an important way to engage residents as active partners in their healthcare and is crucial in promoting resident safety and good health outcomes. It can also increase resident satisfaction and reduce the number of callbacks after a resident leaves. To start out, invite questions. Encouraging residents to ask questions can be as simple as saying, "What questions do you have?" This specific wording creates the expectation that they should ask questions. Use body language to invite questions. Sit, don't stand. Sit at the same level as your resident. Look and listen. Look at residents when talking and listening, as opposed to looking at the chart or a computer. Show that you have time. Be conscious about presenting yourself as having time and wanting to listen to their questions. Try not to interrupt. Help residents prioritize questions. If residents have a long list of questions, help them decide which ones are most important to address at this visit. Have them schedule another visit to address the rest of their questions. Encourage all staff to make sure questions are asked and answered. Check-in and rooming staff can encourage residents to ask any questions they have during the visit. Check-out staff can ask residents whether all of their questions were answered. Make sure to have a plan for how to respond if a resident says no. Remind residents to bring questions with them. Appointment reminders can suggest residents bring a written list of questions with them. Checkout staff can suggest residents write down questions that occur to them after they leave so they can ask them at the next visit. Encourage residents to ask questions in other health settings. For example, if a resident is taking a new prescription, you might say, "Be sure to ask the pharmacist if you think of any additional questions about your medicine." Track your progress. A few resources you can use are the Teachback method, Ask Me 3, and Questions Are the Answer. Tool number 15 is making action plans. An action plan outlines one or more easy steps a resident can take to attain a health goal, such as losing weight or improving self management of a chronic condition. This tool will guide health workers through the process of creating and using action plans in collaboration with their residents. First, watch an action plan video. Search online for the 6-minute American College of Physicians Foundation video, which shows 3 examples of creating action plans for management of diabetes. Create an action plan yourself with your residents. Ask permission to talk about health behaviors. For example, would it be okay if we talked about improving your blood sugar level? Determine motivation. Does the resident express the motivation to change? If residents do not show interest in making changes, Explore what barriers might stand in their way and what they see as possible benefits of changing their lifestyle. Have residents choose the goals. In order for the plan to be successful, the goal must be important to the resident, and he or she must be motivated to change. Ask residents what matters to you. Have a list of goals to give residents ideas on what they could work on and help them decide on changes they are motivated to make. Help residents break down goals into manageable steps. Have residents pick one specific step they are likely to do. Steps should be small and realistic to do over a short time. Fill out an action plan form. Use a form to outline exactly what the resident will do. Keep language preferences in mind. Assess confidence. Assess the resident's confidence by asking, on a scale of 1 to 10, how sure are you that you can follow this action plan? Research shows that a confidence level of 7 or above increases the likelihood that the resident will carry out the plan. If they are not, the health worker and resident should explore ways to revise the plan so the resident feels more confident. Identify barriers. Ask the resident what might stop you from following this action plan. Problem solve about how to overcome barriers. Make a copy of the action plan. Give a copy to the resident and place a copy in the resident's record. Last, follow up after the visit. Follow up lets residents know that you are interested in helping them achieve behavior change. Ideally, set up a time to follow up a week or two after the resident's visit. See tool number 6, Follow Up with Residents, for more guidance. If the goal wasn't met, help residents develop a plan that can be achieved. If the goal was achieved, celebration and praise are in order. Work with residents to plan the next step. Each small step gets residents closer to the ultimate goal of improving their health-related behaviors. Tool number 16 is helping residents remember how and when to take their medicine. As a health outreach worker, it is likely you will encounter residents that are prescribed medicine as treatment. Research has shown that residents often have difficulty knowing how and when to take their medicines, especially if their routines are complex. Residents with limited health literacy tend to have particular difficulty in taking medicines accurately. Helping residents understand and remember what medicines they need and how to take them can reduce errors. Start by asking residents how they remember to take their medicines. You might say, everyone forgets to take their medicine from time to time. When was the last time you forgot to take any of your medicine? Provide residents with a list of medicines. You can always edit documents to provide residents with simple documentation of what medicine to take and when to take it. Anticipate and prevent errors. Always have precise instructions for taking their medicine. For example, instead of writing twice daily, write take 1 pill in the morning and 1 pill at bedtime. Include a plain language description of what the prescription is for. For example, for high blood pressure. Warn residents about possible changes in the color, shape, and size of the pills. Make residents aware that color, shape, and size of pills may change when they refill prescriptions. Reassure them that, as long as the name of the medicine and the dose are the same as what they are used to taking, their medicine will work the same way and should be taken as originally directed. Make it easy. Provide pill boxes. Teach residents and caregivers how to fill a pill box using their medicine list as a guide. Enlist help from family members. Family members can play an important role in reminding residents to take medicines or setting up and filling pill boxes. Advertise ways you can help. Tell residents that you can help them set up reminder strategies such as pill boxes and medicine lists. Synchronize refills. Encourage residents to set up refills for multiple medicines so they occur at the same time of the month. Document reminder strategies. Make sure residents' reminder strategies are documented in their record. Tool number 17 is getting resident feedback. Frequently, offices are unaware of the level of difficulty residents encounter in reading or completing forms, understanding health information, and navigating the healthcare system. Residents are in the best position to judge if an office poses health literacy challenges. Getting resident feedback can highlight features of your office that may cause difficulty for residents and help you identify areas for improvement. Choose from among the following ways to get resident feedback. Using multiple methods of gathering resident feedback will improve the caliber of the information you receive. Start by shadowing residents. Have a staff member shadow residents. A staff member can accompany a resident during a visit as a quiet observer. Shadowing can provide valuable insight into how a resident experiences your practice flow and communication. Decide how many residents you want to shadow and the time frame within which you would like to complete the shadowing. Select residents to shadow who are representative of your practice in terms of age, gender, race, ethnicity, language, and health issues. A mix of new residents and residents who have been coming to your practice for years is ideal. When shadowing residents, stay with them from the time they check in until they leave. At the end of the visit, ask the resident what went well and what was difficult about the visit. Next, conduct a walkthrough. Have a person unfamiliar with the practice walk through it with a staff member and give feedback on the signage and the physical environment. Be sure that anyone who conducts a walkthrough will not observe any private or confidential interactions. Observe residents using your resident website. After you let them explore the site, ask them to complete a specific task and ask them to describe what they are doing. Observing how residents use your website will help you know where changes in appearance, wording, organization, or navigation of the website may be needed. Ask residents for feedback on forms or other materials. While a resident or a family caregiver is waiting for a visit or at the end of a visit, ask him or her for feedback on how understandable your written materials are. Remember to evaluate materials you did not develop as well as materials you created. See tool number 11 and tool number 9 for more information. Have a suggestion box. Let residents and caregivers know you want to hear from them about any difficulties they have understanding information they have been given or getting the help they need. You can also survey your residents. You can gain valuable insight from residents by conducting a survey. There are 5 main decisions to make when surveying residents. Choose a survey tool. There are a number of surveys you can choose from. Choose a resident population to survey. How you choose the residents to survey can impact the feedback you receive. You can use a random sample of residents, such as choosing every third person. A random sample of residents is generally better because it is representative of your resident population. To measure improvement over time, however, you have to limit the sample to residents who have had interactions with your office since changes were made. Choose how many residents to survey. Generally, obtaining 50 completed surveys will give you a good idea of how your office is doing. The larger the number of residents who respond to your survey, however, the more confident you can be in your results. Choose how to administer the survey. Then choose how to analyze survey results. Staff can create a spreadsheet and enter survey responses into it. Then you can total the number of low and high ratings to help you understand your survey findings. Act on your results. Bring aggregated results back to your health literacy team when you have finished obtaining resident feedback. Be sure that the data does not identify specific residents and their responses. Use the information to identify areas for improvement. Collect resident feedback as a routine part of your quality improvement activities. Obtaining resident feedback is not a one-time activity. It should be done on a routine basis. Consider obtaining feedback from a sample of residents every quarter. This concludes today's training on improving self-management and empowerment. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative led by the New Haven Health Department. Join us for our final training coming soon on improving supportive systems.